Roughly 80% of people walking into bariatric surgery have a micronutrient deficiency. When you get to vitamin D, it's 90%. That's not after surgery, that's before. Nobody necessarily tells you that at your consult. So let's talk about what the data shows and how you can improve your outcome after bariatric surgery. I'm Dr. Patrick Denard. I'm the founder of Thrive Protocol, and I'm not a bariatric surgeon. In fact, I'm an orthopedic surgeon, but I have a lot of years of experience watching people get through surgery, and I've seen that there are certain things that are within your control to optimize your outcome. And while I'm not a bariatric surgeon, I follow the data closely, and the principles are broad and can apply to help you get the best outcome possible. What I want to give you is what I think patients across every surgical specialty get shortchanged on. It's what the nutrition data actually shows. And it's things that you can do within the weeks prior to surgery and the months after surgery to really improve your outcome and get back your life, because it's a major decision to go through something like bariatric surgery. I applaud somebody for trying to change their life, but they want to have one surgery and they want to have it minimized complications, a low risk. And one of the best ways you can do that is to really pull on the nutrition arm, because that window is the whole point. Almost everything in this video is fixable, and it's fixable now. One of the first concepts to understand is you're starting behind. A study in 2023 looked at 174 bariatric surgery candidates screened before surgery. Again, 80% had at least one micronutrient deficiency. Vitamin D was deficient or insufficient in about 90%. Folate deficient in 44%, vitamin B12 in 6%. Now, here's why that's not intuitive. We tend to assume that nutritional deficiency is a problem of eating too little, and therefore somebody who's overweight gets all the nutrients they need. It turns out the data shows that that is exactly not the case, and the Western diet sets us up for poor nutrient status, and especially that occurs in people who are overweight. So the starting line isn't neutral. Most people begin in this process already short, and then we take away the stomach capacity. So here's the arithmetic that nobody really walks you through. Protein guidelines after bariatric surgery vary between 60 grams and 120 grams. Now, if you take that next to a stomach that's been shrunk in size due to bariatric surgery, and you're talking about a 2 to 4 ounce capacity, add nausea on top of that because you've just gone through a major surgery, it is a setup to really get very low protein in your diet. You can have food intolerance as well. You can have altered absorption. If you put this into perspective, 60 grams of protein is roughly 8 ounces of chicken breast. In the first month after a gastric sleeve or bypass, that is a difficult thing to sustain in your stomach. It's a volume problem, and a large number of patients simply don't get enough protein after bariatric surgery, which brings up the question, really, what matters? So what does this shortfall cost? And here's what it really comes down to. When protein intake doesn't keep up with rapid loss, your body doesn't take that politely. Your body keeps score. And what your body does is it starts taking energy from muscle. And those people who do not get enough calories as a result or a follow-up of bariatric surgery end up losing muscle mass dramatically afterwards. And that's a big problem because it affects your strength, it affects your vitality, and it also affects your metabolic state because muscle burns more calories. Muscle is really, as people talk about now, the organ of longevity in many ways. So this is well recognized in bariatric surgery, and it's one of the reasons your team will push protein, at least from the first post-operative visit, because they want to avoid the loss of lean muscle mass. And it's a measured phenomenon, not a theoretical one. So it's not just cosmetic. Again, it's your metabolic rate and strength. If you have less muscle, your metabolic rate goes down and it becomes harder to lose weight afterwards. So you might get a short-term result, but it's harder to maintain that 3 and 5 years. And when you're doing something like this, you really think about it's a surgery that's going to help me alter my body, but you're really making an investment in your health. And you don't want to just lose weight for 6 months or a year. You want that to be sustained and remain off over time. And that's why muscle preservation is so critical. And that's really the argument here. The operation is one variable. It's a big one, but it's not the only one. Now, here's what I find encouraging. It doesn't come directly from bariatric surgery literature. There's a lot of literature on this in orthopedics and then across all specialties combined. And essentially, what you find is that if people prepare in advance, they can improve their outcome and they can maintain muscle. For instance, a study in 2016 looked at nutritional risk, and half of people undergoing any surgery had some nutritional risk. But those who had nutritional risk stayed in the hospital 13 days compared to 7 days. Specifically, when you look at what you can do in advance, a systematic review or meta-analysis of 186 trials looked at prehabilitation. So prehabilitation is a concept of preparing in advance to improve your outcome afterwards. And this study found that nutritional preparation was associated with about a 38% reduction in complications and roughly a day shorter length of stay in the hospital. Now let's take that in. 38% reduction in complications is a massive difference from simply taking steps to improve your outcome by modifying your nutrition. So this isn't just a fringe finding, and note the direction here. This isn't waiting until afterwards. This is preparing in advance before the operation. So it's a rare part of your surgical outcome that you can influence on your own timeline by starting in advance. So here's how I like to structure rehabilitation or recovery from surgery. Really 3 phases. You want to prepare, you have your surgery day, and then you have your healing or recovering phase. So how do you prepare? The week before, and honestly, if you can, even weeks and months before, you want to increase your protein. You want to make sure you're getting vitamin D, getting vitamin B12. You could even consider having those levels checked. I personally, as an orthopedic surgeon, check vitamin D levels in all my patients because there's a lot of importance in tendon and bone health. So we want to know where you're at going in. If you haven't had that done, you want to at least store your body with the appropriate amino acids and protein so that your body has the reserves to get through surgery. And again, those micronutrients like vitamins are really, really important. On the surgery day, there's data across multiple specialties that shows that if you do carbohydrate loading the night prior to surgery, you can improve your outcome. Those who do carbohydrate loading have been shown in studies to have a lower length of stay, better ability to eat afterwards, and less nausea afterwards. And what does this come down to? The concept is simple. If you look at an athlete who goes to an event ahead of time, they want to make sure they have carbohydrate to have immediate energy. Remember, surgery is a stressful event. If you load your body with glycogen, which is carbohydrate loading, you have the immediate energy stores that your body uses to fight through that surgery, so to speak, and that puts you in a really good position afterwards. And then finally, in the recovery phase, you need to have high amounts of protein. Again, that can be very difficult to obtain in the bariatric surgery setting. How do you do that? Well, one of the easiest ways to do that is with protein shakes. What we did is we created OptiFuel, which has high amino acids, specifically high in leucine, which is really good for muscle preservation, high in glutamine, which helps immune response. We also included collagen, which is important for healing, as well as vitamin D, vitamin C, and omegas. By getting this all in one package, you can really improve your outcome and get everything you need in a small concentrated setting. Plus, it's simple to take. Now, you can of course do this in many ways, but the concept remains the same. You want to have high protein, you want to have the specific amino acids that help improve or preserve your muscle, which have been shown clinically to do so, and all the vitamin and micronutrient supply that you need for your body to heal. So I'll just close by saying, take this concept to your bariatric surgery team. Think about what you can do to prepare in advance. They set your protein targets in your diet stage. My job is just to help give you some information, give you the questions to ask and how you're going to achieve that. We have the full protocol or information on bariatric surgery in the reference on our website. And one more thing before I go, surgery is one day, but recovery, there's months around it. Prepare for both to set yourself up for a long time successful procedure, and good luck.